Have you heard of Lou Gehrig's disease? ALS was actually once commonly known as Lou Gehrig's disease. This is following the retirement of a famous ball player in the 1940s due to the disease. ALS is a rare neurological disease. It affects nerve cells that are really responsible for controlling muscles that we choose to move, like chewing and walking and talking. The tough thing is the disease gets worse over time, and there really is no cure for ALS and no real effective treatment to reverse, the disease getting worse. So that we understand really what's going on here, ALS it's known as what's called a motor neuron disease, which basically motor neurons are nerve cells that go from the brain to the spinal cord to the muscles throughout the body. As these motor neurons sort of deteriorate, they actually stop sending messages to the muscles, and the muscles weaken. They twitch, and then they waste away. And eventually, the brain loses its ability to initiate and control some of these movements that we need to control, chewing, walking, talking, things like that. Unfortunately, we really don't understand the cause of ALL. I mean, we think that there's part genetics and part environmental causes that may be playing a role. We don't exactly know why ALS strikes some people and not other people. Early symptoms of ALS usually include things like muscle weakness or stiffness. Gradually over time, people lose their strength, their ability to speak, to eat, to move, and to even breathe. This is the tough part. And this is the thing, though, because people with ALS often can perform higher mental processes, they can often reason, remember, understand, and even problem solve. Oftentimes, these folks are actually aware of the fact that they are losing their function as time goes on, and it can be really distressing, can cause anxiety, depression, as you could only imagine. Unfortunately, most people with ALS eventually die from respiratory failure. A couple of things to keep in mind, there's a lot we don't know about the disease, but we do know that it can strike at any age, but most commonly strikes at the ages between 55 and 75. Men are slightly more likely than women to develop ALS. We know, as I mentioned, there's no treatment to reverse the damage to the nerves or cure ALS, but we do have treatments that can kind of help control symptoms, try to prevent complications and things like that. When someone has ALS, this really involves multidisciplinary care. Supportive health is really best provided by multiple people. Professionals such as pharmacists, your physician, obviously, physical therapists, occupational therapists, speech therapists, social workers, nutritionists, things like that. ALS can be very, very tough, not only for the patient, but for the caregivers as well. Guys, I hope this is helpful to talk a little bit about this condition that we don't always talk about. Let me know in the comments if you know someone who has ALS, if you are suffering with a neurological condition yourself. I do believe in the importance of awareness. And as always, I say, if you ever experience symptoms that are not right or that don't make sense or not usual for you, make sure that you're seeking out medical care. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please like and follow my page on Facebook. And for those of you who send stars, I respond to you personally. Thank you so much. On YouTube, please subscribe to my channel. Click the little bell for updates. And also check out my website, drjencaudle.com, for my free health newsletter and my daily health tips. Guys, I'm Dr. Jen. I'll see you soon.